Thank you for joining us today for the 5th Annual Policy Summit presented by the American Association of Kidney Patients. This year's summit is titled Patient Voice, Patient Choice, New Determinants for Kidney Policy. My name is Ed Hickey. I'm president of AAKP and serve as the chair of the Veterans Health Initiative. Professionally, I'm a veteran United States Marine Corps infantry officer. My public service career includes posts on Capitol Hill as an administrative assistant to a United States Congressman and a special assistant at the United States Department of Congress under George H.W. Bush. Following the terror attacks of September 11th, I also served as a senior advisor for Homeland Security for the Director of the United States Civil Service under President George W. Bush. Currently, I'm a practicing attorney in Los Angeles. I'm active in the armed forces legal community, working locally with the Veterans Legal Service Project of the LA County Bar Association to support the legal needs of active military personnel, reservists, and veterans. And at a personal level, I'm a fellow kidney patient. I'm also an experienced caregiver and patient advocate because of the history of kidney disease within my family. I'm pleased to introduce our session titled Critical Barriers to Care Transformation: How Payment Policies Impact Kidney Patient Consumers and Innovation Leaders. AAKP has, for over 50 years, been a champion for patient choice and innovation in kidney medicine, including therapeutics, diagnostics, and devices. That is why AAKP fights for solutions that help diagnose disease earlier, slow disease progression, and helps stop kidney failure. We are strong advocates for preemptive transplantation, greater access to kidney transplants for all patients in need, and home dialysis. AAKP defines high-quality kidney care as timely patient access to therapies that keep patients healthy and fully capable of pursuing their aspirations, such as maintaining a career in meaningful part-time or full-time work, starting a family, owning a home, and retiring securely. After decades of stalemate and little innovation, the kidney community is witnessing a golden era in kidney drug and device development. That is why, in part, AAKP declared the next 10 years is the decade of the kidney. In the past several years, the U.S. Food and Drug Administration has approved several new and safe treatments that help patients better manage kidney diseases and related conditions. AAKP anticipates more approvals in the coming years. These approvals require tremendous research, investment, patient participation in clinical trials, and advocacy. And to be clear, each FDA approval is a significant victory for kidney patients in need and the companies and researchers who have committed themselves to transforming status quo kidney care. Yet these victories are incomplete if patients cannot access the drugs and devices once the FDA has found them to be safe and approved for patient use. Patients, medical professionals in the industry are becoming increasingly frustrated by the cumbersome barriers to patient consumer access to the innovations patients have fought for decades. Some payers, including insurance companies, and at times the Centers for Medicare and Medicaid Services, or CMS, either intentionally or through a lack of understanding of the patient burden of kidney disease, erect barriers to access these FDA-approved treatments. In some cases, some payers do not support these innovations at all. AAKP believes access must be addressed now because access to future innovations will be negatively impacted if we are not successful in these initial fights. Fighting for patient access to new innovations takes courage, political sophistication, and the fortitude to win. This is why AAKP launched its Patient Voice, Patient Choice Initiative in 2022. Through this interactive platform, patients and care partners can quickly identify barriers impacting care, choice, and treatment. Through AAKP, patient consumers can engage elected leaders, government agencies, and payers to raise their voice when timely access to safe, FDA-approved treatments and devices are hindered by nonsensical barriers. Simply put, AAKP is 100% committed to making certain patients receive the right treatment at the right time based on the guidance of the doctors they choose to give them care. Our next speaker is Dr. Neil Warnock, Senior Director of Medical Market Access Data Generation and Observational Studies at Bayer. Dr. Warnock is a strong patient advocate with a particular interest in helping patients gain access to new therapies that delay disease progression and help stop kidney failure. He has worked close with AAKP staff to provide important insights on new, safe therapies entering the market and important related patient education efforts. Dr. Warnock, the floor is yours.
Thank you for having me today. I would like to introduce myself. My name's Dr. Neil Warnock. Today I'm going to be talking about who makes decisions regarding your treatment. So my presentation will focus on some of the potential barriers that may be in place restricting a patient or your ability for new and innovative therapies. Today I'm going to focus on patients with chronic kidney disease, often referred to as CKD or abbreviated as CKD, associated with their type 2 diabetes, or also known as T2D. So what are we going to cover today? I'm going to provide an overview of chronic kidney disease. Have you been diagnosed or told you have chronic kidney disease? Another challenge or issue for many patients with CKD and their type 2 diabetes is that they have cardiovascular or heart disease. You may have heard terms such as you have hypertension or heart failure. The pumps, the heart and the kidney, are not working well in patients with chronic kidney disease. This disease impacts both of those pumps, the heart and the kidney. What are some of the care challenges? What are the challenges and why it's important to get treated now, especially because there are new therapies available? CKD is a population health problem in the US. Another way of thinking about it is that chronic kidney disease affects a large number of patients in the US. There's often low awareness by patients that they have chronic kidney disease, and this can make managing the disease harder for doctors. It's often a silent disease. So in the early stages of the beginning of the chronic kidney disease, as patients would typically move or progress from having type 2 diabetes to chronic kidney disease, they're not aware. They don't feel any different. They may not have any symptoms. That's why it's called a silent disease. And then what are some of the key topics to know about how your health plan or your health insurance may impact what drugs your doctor is able to use to treat you? There are steps you can take to help improve your care, and we want to talk about what those steps are. So know your status. So if we look at the picture of the US, there's over 35 million patients or people with type 2 diabetes. Of those, about 40% will develop chronic kidney disease. So that's a large number. The other challenge, as I mentioned, is that a lot of patients that have diabetes and chronic kidney disease aren't aware that they have the disease. They don't know that they have chronic kidney disease. On the bottom, you can see that in the green part of the slide, it's important to know what stage you're at. There's the number of people with diabetes will continue to grow. So we'll have almost twice as many people by 2060 as we do now that have diabetes. And again, we anticipate the same percentage of those patients will develop chronic kidney disease. So it's important to know what stage you're in, and if have early stage disease or later stage disease, or what's known as end stage, right at kidney failure, and right before you would typically go to dialysis. Some of the facts on this slide, I think, really reinforce the importance of knowing your stage of disease. Your doctor may give you a number and say you're stage 1 or 2. There's 5 different stages, as I mentioned, 5 being the most advanced. So it's really important. Some of the things to consider: every 24 hours, 340 people will begin dialysis. This is a life-changing process for patients to go through. In the United States, diabetes and high blood pressure will cause 3 out of 4, 75% of patients with kidney failure. Without treatment, without getting the chronic kidney disease treated, it can lead to end-stage kidney disease, which patients then will have to go on dialysis or wait for a kidney transplant. The other important thing to note on this slide is that half, or 50% of all patients with chronic kidney disease wind up dying from their cardiovascular disease. So these patients, which you may be one of, that have type 2 diabetes and chronic kidney disease, about half of those patients also have some form of cardiovascular disease. On the bottom, you can see here that what we're going to now start to have a conversation around is the control your health insurance may have on what you as a patient receive. And it isn't always what your doctor has initially prescribed. So we can see that 14 million Americans may have trouble getting their medication that was prescribed for their chronic illness, as chronic kidney disease being one of those. These barriers can happen when your doctor and your health plan don't agree about what treatment you should receive. So getting tested is important to see if you have chronic kidney disease. Maybe you don't know if you have chronic kidney disease and you're a diabetic. Once you've been diagnosed or told by your doctor that you have chronic kidney disease, it's important to get the treatment, especially now that there are new therapies available. These are some of the problems in getting to care, is just testing. There's new incentives for both the doctor, your doctor, and your health plan to make sure that you're getting tested, to make sure that you get the appropriate diagnosis, and to make sure now that you get access to some of the new treatments. There haven't been treatments until last year that are new for chronic kidney disease. And so it's really important to make sure that you're getting the best treatment, the treatment that your doctor thinks would work best for you. On the bottom, you can see that chronic kidney disease or end-stage kidney disease, again, that would be those patients that go to stage 5, that's the most advanced, will occur more likely in Black, Native American, and Hispanic patients. So the top of this slide helps us explain what patients with chronic kidney disease have experienced, again, over that last 20-year period until 2021. What's typically happened is there was a large number of patients that didn't get diagnosed. And a part of this is there weren't any new therapies. So there were not as many resources that were focused on getting patients diagnosed. Then the recognition of the stage or where you were at or where the patient's kidney damage was. Patients were getting diagnosed later in the process. So as you can see on the top there, stages 3 and 4, which is more advanced. And on the bottom, you can see that primary care physicians were trying to manage the bulk of this. The referral wasn't going to a nephrologist until it was right about the time the patient needed to go on dialysis. So on the bottom, what we can see is the referral to the nephrologist or the kidney doctor now can occur earlier if needed. But on the bottom, we're seeing that with a focus on testing earlier and having less patients be undiagnosed, that's represented in that dark blue color, The lighter blue color will have more patients diagnosed earlier. And now there's more therapies, more drugs, more options your doctor can provide for you. So with that, the goal is to get more patients that follow the pathway of the green, where they can delay their chronic kidney disease progression. So it's important that we focus on getting the best therapy for the patient. So in this slide, we're looking at 4 different guidelines that focus on the best treatment options for patients with chronic kidney disease. 4 different guidelines have been updated just this year in 2022. And because of these new treatments being available, this is based on a lot of new information for the guideline committees to review. All of the guidelines focus on the importance of your doctor choosing the best drug or drugs for you, the patient. All of the guidelines focus on improving patient outcomes or the results by using the drug with the best results from when they were tested. So they go through a testing and approval process before your doctor can write a prescription for you. It's rare to have this many guideline updates within a single year. It's the result of some very good data being available supporting new therapies. The guideline updates show the importance of your doctor having that ability to use the most innovative and best available drug to treat your chronic kidney disease. Part of the process now is that the insurance company or the insurance plan will use. And this is part of the challenge for your doctor, is what's known as a prior authorization. This is part of that. It connects back to the title of my presentation about who's making treatment decisions. So what is a prior authorization, or some of the steps a doctor must follow, regardless of the drug that they've chosen for the patient or for you? Your doctor has to follow this process based on whichever health insurance company that they're working with. So based on the insurance that you have, the doctor writes a prescription, and then they have to follow that prior authorization that may be in place for the chronic kidney disease medication. The prior auth process, as you can see here, is complex. They're written with clinical or medical input, and there's a business input or cost based on the cost of the health insurance when these are developed. So the bottom line here is that there's financial reasons why a drug, or the ability of your doctor to write a prescription for a drug, may require a prior authorization. So if we look at the slide, you can see, starting on the left, that the physician has ordered, in this case, we'll focus on a drug. Then it goes to someone on his or her staff that starts this prior authorization paperwork. There's forms to fill out. The staff can then check the requirements. Again, this is a complex process. The staff supporting the doctor then may have to call the health plan. They can be put on hold. The staff would then retrieve the forms based on what they're told to process the prior auth. Sometimes they're available online. Sometimes they have to go to a different source to get those. Often those forms then get faxed back to the health plan. And then towards the end there, you can see where the PA becomes processed. This could occur as quickly as a day. It could be a month. Sometimes it's longer than that. And then based on the decision from the time when the doctor has decided that this drug is the best for you, their patient, to going through the PA process, one of 2 things occur. That prior authorization is either approved, which you can see by the green check mark, or that prior auth is rejected. So once they're rejected, the doctor and their staff have the option of appealing that rejection. In some instances, the patient then can receive the drug that the doctor ordered. But in those instances when it's rejected, then that appeal process starts to initiate. And this can be complex. It may require the doctor to call or write or send an additional form to the insurance company. That appeal can sometimes take 2 to 3 steps or more before it eventually could either then be approved or rejected. The problem is that this could be days to weeks to months. And then based on how busy the doctor is that's written this prescription, there may be an alternative therapy or a second choice that the doctor could use. But again, due to the amount of time, to the cost, to the overall expense, the doctor and the patient don't always come together necessarily on what that second choice could be. There are times where patients then wind up not getting any therapy. And this is really unfortunate, especially now for those patients with chronic kidney disease, because there are new drugs available. To try and simplify the process, I'm going to walk through this example. So on the left, you can see there's 2 different types of treatment, 2 different choices that the doctor has to treat the patient. And they choose product A. Then as we move to the center, this is where that PA or prior authorization process starts to occur. The health plan requires the doctor to use product B instead of their choice, which was product A. So this is a barrier called a step edit, which requires that the doctor use product B first. Another barrier, as we've been talking about, a prior authorization may require the doctor to send a form or write a note or call the health plan or health insurance company as to why their choice of product A was made before the health plan will consider covering it or allowing it. The problem then are that all of these barriers will cause a delay in the patient getting access to the best treatment. So the medication that your doctor has decided is best for you is the right choice. There could be a long delay. And as I mentioned on the last slide, you may not get to an alternative or a second choice. Product A or product B, neither option may wind up being used for the patient. So this is a simplified general example. Every situation could be different. So it's important that you are your own best advocate. You need to consider action you can take now and really work towards supporting yourself to get the best care. So if you haven't been tested, get tested, as you can see on the left here. If you have diabetes and you're not sure if you have chronic kidney disease, or if you have chronic kidney disease, you've been told that by your doctor, make sure you get tested every year. It's important. In the middle, in the blue, have a conversation. Ask your doctor about treatment options. Most patients with chronic kidney disease take a lot of different medications, and there are options. There's medications available that can help delay heart and kidney disease and delay how fast or how quickly they progress. And if you find out that you have a barrier, contact your health plan. Every health plan has a process for you to get a hold of them, and you can ask them questions. Talk to your doctor, talk to the doctor's office. Make sure that you get the medication you need. And thank you for your time and attention today. It's been my pleasure to speak with you.
Thank you, Dr. Warnock. That was a tremendously helpful and insightful presentation.